صباح الخير. So today is day 2, so we're going to do a very quick summary of day 1, and then we're going to talk about communication, behaviors, follow-up. We're not going to talk about medication in depth today, but you do have the lectures in front of you, and if you have questions about the medications, just ask me after the lecture.
المحاضرة اللي فيها راح ناخذ نبذة سريعة الآن كمراجعة سريعة للأمس. كان المفروض اليوم نتكلم عن أنواع العلاجات المستحدثة، لكن لأن الموضوع علمي مغلق شوي فنضطر نأجل بعد ذلك لأن العلاج نفرض عليه.
And so yesterday we talked about the CARES program and how in order to care for a person with Alzheimer's disease, you have to be able to communicate.
اليوم راح بس نعطي نذكر ثاني مرة على برنامج الكير تكلمنا فيه أمس وخطوات المتخذة في الكير بنفسه.
And so the main thing is to care for the person and maintain their dignity and be able to understand the person individually.
الفكرة الأساسية في برنامج كير هي الحفاظ على دينونة صاحب الزهايمر والحفاظ على نسميه دينونته، إنه هو صاحب القرار في اتخاذ القرار غير موجه.
And so even if you don't remember what the CARES stand for, then you still understand that it's cares, that you need to care.
الفكرة الأساسية مش فقط اللحظة بس، الفكرة الأساسية شو المقصود من كلمة كير؟ إن الترجمات العربية معناها العناية، العناية بالزهايمر.
And so we had a C, which was connect with the resident, and we did an activity where you looked to your neighbor and tried to understand a little bit about them.
أول حرف اللي قلنا عنه C التواصل وطريقة التواصل مع مريض الزهايمر وطريقة التواصل مع أفراد الجمعية.
And so we also talked about the stages 1, which is really no disease present, all the way to 7. And so when they're even in 7, you still need to understand their life story.
وتكلمنا عن مراحل الزهايمر 7 اللي يدش فيها، بس أهم شغلة في المراحل 7 فيها نفهم شنو هو الاحتياجات المسن اللي أثناء لما يدخل في المراحل هذه تكون الأعراض اللي ما شلون تقدرون تتعاملون معها.
And A was to assess the behavior, because we know that a person with Alzheimer's disease is going to have different behavior. So you need to know how to assess this behavior.
وحرف A كلمة كير كلمة ثانية الحرف الثاني نقصد فيه اللي هو تقييم مريض الزهايمر نفسه من الأعراض اللي قاعد تصير له. في البداية لما تعرفون أنتم احتياجاته وطلباته قد لا يستطيع يعبر عنها في مراحل المرض، فكلمة A هذه يقصد فيها اللي هو أنتم شلون تعرفون تعابير مريض الزهايمر اللي تعرفون من خلال احتياجاته.
And then R was to respond appropriately.
حرف الآر الموجود في كلمة كيفية رد الفعل المناسب أو الفهم الفكرة المناسبة.
And so we even discussed how you can carry a little tiny journal with you. And so whether or not you're taking care of the person in the house or a hospital or a nursing home, you should keep a journal of the behavior and what we can do to help the behavior and what works and what doesn't work.
الفكرة في الأسسمنت يفضل أن يكون عندكم مذكرة تكتبون فيها اللي هو الخبرات اليومية اللي مع مريض الزهايمر اللي ما بعد ذلك لأن مريض الزهايمر يكرر نفسه بالمرة، فلو أنتم كتبتوها في مذكرة يتم متابعة حصل رد الفعل أول ثاني مرة تعرفون شلون تتعاملون معه من خلال الدائرة اللي معكم أو المذكرة.
E is to evaluate what works.
نعرف في مريض الزهايمر يمر بسبع مراحل، ففي كلمة E اللي هو إعادة تقييم مريض الزهايمر بعد كل فترة. هنشوف التطور اللي حصل، الانتكاسة اللي حصل فيها. مسألة الإي هذه عبارة عن إعادة تقييم مريض
And then in order to evaluate what works, we understand that it's going to take a lot of time. Okay? It's going to take a lot of time, trial and error, to figure out what works. And we talked yesterday about how our culture does not allow us to spend time and to evaluate. But it's very important that you evaluate what's going to work best to change the behavior.
دائما في مسألة التقييم يعتمد على مسألة الصح والخطأ وما هو الأنسب للتعامل مع مريض الألزهايمر. احنا عارفين مريض الألزهايمر فترة المرض فترة طويلة جدا وممكن يمر بتجارب كثيرة ومسألة الصح والخطأ واردة عليه.
And S is to share the findings. And so communication, we'll find out in the next couple of slides, is extremely important. And so when you don't have communication and you have this breakdown in communication between siblings and providers, that's where you're not going to. And so what are some communication challenges that we're going to have to deal with? Because communication is a two-way street. If I'm listening to someone that has Alzheimer's, this is going to be a barrier because they may have some of these problems.
يعتبر من وسائل التواصل مع مريض الزهايمر التحديات الموجودة تحدي التواصل في مشاكل في مسألة التواصل شنو التحديات اللي تعرفونها اللي راح تكون مكررة في مريض الزهايمر اللي تكون أحد أنواع تحديات التواصل في الإنسان.
So word finding.
معرفة الكلمات، اختيار الكلمة، قد يكون مريض الزهايمر يعرف الكلمة لكن لا يعرف شلون يقولها.
Repetition.
تكرار، ترديد الكلمة بشكل متواصل.
The loss of reading and writing.
عدم القدرة على القراءة والكتابة.
The loss of ability to understand.
عدم القدرة على فهم الكلام اللي انتم بتقولوه وما يستوعب الكلمة اللي انتم بتقولوها أو العكس.
And then later we find out that they have the inability to just use words in general.
وبعض المرات يحوي عند نسميه الملكة النبوية عند تصبح طيبة يفسر نفسه بنفس الكلمات. أي شيء جديد يخرج من اسمه يكون نفس الكلمة. وهذا يعتبر أحد أنواع التحديات القدرة أو نسميه الملكة للكلام نفسه.
And so we have two types of communication, verbal communication and non-verbal communication. Okay. Verbal is going to be the type of words that you use, where you place the words, and even the type of dialect you have. Then we have non-verbal communication. So we have body language, which is like 50% of communication. Right? And so it's a sign of boredom, okay? And so even if I start lecturing like this, you're like, what's wrong with her? So I don't really have to say anything, you know something is wrong.
أو الحناء أو شغف بالطريقة ملفتة للنظر وهذه أحد أنواع يعطي فكرة للشخص الثاني لما في عنده شيء يتواصل فيه معه.
And I found this slide on the internet and I'm just in love with it. Because when we say body language, it doesn't mean our extremities only. Our eyes, right, they say are the windows to our soul.
من أحد الشغلات الأساسية عندنا اللي هو التواصل غير اللفظي منظرة الوجه وتعتبر من أحد الشغلات اللي حسب التأثير هي الوجه يعبر عن النفس.
So think about the last time someone said, do you remember that restaurant we went to? And you went, and your eyes kind of shifted to the right. So no one says, let me try to remember. So no one focuses straight ahead when they do that. Their eyes kind of shift to the right. And then the other example is smell. When you smell something, you tend to go, smells good, and our eyes go up. And see, this is little things that we totally forget about.
هل تتذكرون المثال اللي ضربته تتذكر الأكلة المعينة ناخذ مسألة
this is the schematic of different types of body language. And so what is this?
تعبير هذا عبارة عن شنو؟ يفشل شكل الجسم لأن المرحلة هذه.
Fear. Yeah, fear. Good. And then what about this one? Like when someone goes, what does that mean to you when someone says, yeah, come, acceptance, openness. Yeah. Okay. So making a positive physical approach is the primary step in communication.
ويعتبر حركات الاستفيد هذا تكلمنا عنها قبل شوي من احد وسائل التواصل او الاساسيات التواصل مع المريض.
The man nurse, can you come up here? Come. Yep, come on. I'm going to put this over here. My demonstration. And so he is going to be the person that has Alzheimer's. Okay, and so sit down, please. And so understand that he has some type of cognitive impairment. Okay, one of the phases from, let's start with 2, maybe 3 even. Okay, so we're in the mild Alzheimer's stage. Okay.
هذا راح نضرب مثال الان تخيل ان مريض الزهايمر داخل المرحله الرابعه شلون نبتدي نتواصل احنا مع مريض الزهايمر.
Okay, and this right here is going to show you how to approach a person. Okay, I'm going to show you the wrong way to approach a person. Hello. Hi. What? Hello. Hi. Okay. Very wrong. Okay. Why is it wrong?
شلون نتواصل مع المريض؟
Yeah, I came from the back, and he's hearing my voices like this. Okay, and they're already, they have risk for being delusional. If they are delusional, they're like, oh my God, who is this that's trying to talk to me? And then yesterday we talked about how they may have visual changes, okay? And so their peripheral vision is going to, deteriorate over time. And so they're only going to be having their central vision, okay? And I'm coming in from behind them, and they can't see anything on the peripheral.
من احد الاخطاء التواصل معاه من محاضره مريض الزهايمر وهو لا يرى الشخص المتخاطب عليه، احنا عارفين ان مريض الزهايمر يعاني من قصور في مساله معرفه الاشياء بسبب عنده قصور في القدرات الذهنيه نفسها، فمن احد الاساليب الخاطئه كلمه مريض الزهايمر وهو لا يرى الشخص اللي يتخاطب معاه، وهذه من الاخطاء الوارده التي قد تثير المريض اكثر ما تقدم له اللي الراحه والسير مع الانسان.
Okay. And so it's medication time, yeah? And so I have my medicine, yeah? I'm in a hurry, right? It's time for your medicine! Yeah? We tend to see this a lot. He's not processing it. Medicine for what? Why is she coming at me like that? Who are you? Even though I'm his nurse, or I'm his daughter.
ومن احد اخطاء التواصل كذلك اللي هو تقديم العلاج بطريقه سريعه وبطريقه مستفزه، بحيث انه ممكن الصوت العالي والحركات السريعه هذه تخلي المريض الزهايمر يعني يتراجع او يدخل في حاله هيجان بسبب رده الفعل الحاصله راح تصير ما بين الشخص المقدم الدواء والشخص اللي راح يتلقى الدواء.
Okay, and so something else that we tend to do is we'll go, "Hi, Cupcake. How you doing, honey? How you doing? Come on." Yeah? His name is Cupcake? Honey? Yeah? You can have a seat.
والخطأ الثالث أن أثناء التواصل لا نستخدم ألفاظ تعتبر بالنسبة للمريض المسن غريبة يسمعها لأول مرة. هي قد تكون صوت تودد له، ولكن بالنسبة له ما يستوعب الأمر هذا. فممكن هذه الأمور يعني يضع في حالة عداء مع الشخص نفسه. يفضل أن يكلم مريض الزهايمر الذي هو الذي يحب أو الكلام الذي هو متعود بالسماع منه.
What is your name?
Sajid. Sajid.
Sadid? Okay, Sadid. This is what you go by? Yesterday you said brother. Yeah? Did he say yesterday he likes to go by brother? I have a good memory. Inshallah, it stays with me. Okay. And so one of the things that you need to do, and it's on the slide that you have, is to always approach the person from in front. Even if the door is in back of the person, you say a greeting, hello, hello brother, and then you come to the front and you repeat the greeting, okay?
عادة مع مريض الألزهايمر يفضل دائما ما يبدأ التخاطب أو التواصل معه إلا إذا كنت وجه مع المريض، يعني لا تبدأ مع مريض الألزهايمر من الخلف أو من الجنب ثم تأتي للأمام، لا تأتي مباشرة أمامه مباشرة بحيث هو يراك ثم تبدأ التخاطب، وإذا سبقت المفروض لما توصل للأمام تعيد الذي قلته حتى يعرف أنه هو نفس الشخص الذي تكلم فيه معه.
And you approach them slow, okay? Allow them time to process what's going on.
دائما نستخدم اسلوب البطء في الكلام، يعني ما نكون سريعين في الكلام، نتكلم ببطء وبسهوله يعني اقل من المعتاد حتى هو يستوعب، يعني عارفين من اشكاليه استيعاب المعلومات تكون بطيئه.
Okay, and then the other thing is you have to get on the level. And we learn this very early on in practice, okay? And even in society, it's never good to tower on the same, above a person, okay? And so when I talk to you, I don't talk to you like this, right? I try to kind of come down as much as possible. And you should do the same thing, okay? And so you pull up a chair or a stool to get on the same level, or you can just go like this, okay? All right?
ويفضل التعامل مع مريض الألزهايمر أن نكون على مستوى النظر، ما نتكلم وأن نكون أعلى من مستوى النظر، دائما نحاول ننزل لمستوى النظر. فإذا كان على كرسي نقعد له، إذا كان على سرير نحاول نقعد جنبه، إذا كان واقف نحاول ننزل على مستوى النظر، يعني ما نحاول الشخص اللي يتواصل مع مريض الألزهايمر يكون هو أبعد من مستوى نسميه النظر نفسه.
Okay. And then this is a really good statement that a person with Alzheimer's disease is a person, is a human. And so it's not a baby, okay? Would you like something to eat? Would you like something to eat? And so this is, completely wrong to talk to someone like that.
يعتبر مريض الألزهايمر ليس طفل، لذلك يفضل أن يتعامل مريض الألزهايمر بالدرجة السنية التي فيه باحترام، لأن لو نزلت في مسألة الاحترام مع مريض الألزهايمر عادة هذا يخلق نوع من العداوة معه، أنه هو ياهل لا وما زال رجل كبير أو امرأة كبيرة في السن، أنه يحترم مكانته الاجتماعية والتواصل.
And then we talked yesterday about how it's extremely important to allow the person to do as much as possible by themselves.
تكلمنا في النقطة الثانية أن مريض الألزهايمر ليس طفل، فلا يحد من حريته، يترك له أن يفعل ما يشاء، لا يعني نسميه الفرصة أو نقوم نحن أو نقوم إحنا في أفعاله هو، لا هو المفروض يقوم كل أعماله كأنها عبارة جزء مساعدة.
And you want to keep the words very short, simple directions, and you want to try to use repetition as much as possible. And it's going to sound awkward because we don't repeat the same thing. 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 But you're going to have to repeat the same thing.
مريض الألزهايمر دائما يحتاج لمرتب الكلام أكثر من مرة، بمعنى أن الكلام يكون مكرر على طول بفترات قريبة من بعض حتى يتذكر هو الفكرة من التواصل مع نفسه.
Okay. And so we're going to do an activity. Hopefully you guys have the papers in front of you. And it's called the Show Me, Teach Me.
راح تسوي الحين إن شاء الله عملية اسمها ألمي أو علمني.
And so it's this paper right here. Okay. Okay, show me, teach me. Okay, and you should have already a spoon and a cup and a mouth moistener. Okay, and so what you're going to do is you're going to either use the mouth moistener, and so you have to use your imagination here, okay? And by yourself, you're going to come up with instructions on how to show someone, teach someone, how to take medicine out of the cup. So you have to pretend there's maybe food or something in here, okay? And take it to their mouth, okay? If you want to pretend this is a toothbrush, teach them, show them how to brush their teeth, okay? If they need some moisture in their mouth, teach them, show them how to moisten this and take it to their mouth, okay? And so you're going to work on that right now, and that, so step by step, and remember you have to be very specific.
الحين كل واحد فيكم بالادوات اللي قدامنا يعتمد طريقه في التواصل مع اي قدام واحد او قدام واحد من الزهايمر اللي قدامه قفشه واللي او موظف الفم او سواء ما تدور كيف يخترع طريقه يتواصل فيه في اعطاء الشيء يعني شلون تكون هذه هي مش عقد الكل يعني واحد طريقه او شلون يعطي العلاج باستخدام المملكه والكفر.
And then I'm gonna pick on someone to show me how to do it based on their instructions, and we'll see how good you are. So I'll give you 5 minutes.
So we are to write out instructions to?
Yes, to the person. And so if you, yes, so pretend there's medicine in here.
What is it?
This is a mouth moistener. And so we put it in water and, yeah. So write instructions on how to tell someone to use these. Yeah? You don't have a pen? No, Yeah. So let's see how good you are at giving instructions to someone who needs very, very specific directions. Yeah?
تطبيق أحسن.
Yeah.
بدون
medication or food or applesauce or maybe
this
water.
should come from a bottle, not from this. The medical medicine here come from another bottle, not from this one.
Right, yeah. Arabic, English, French, Spanish. You're not writing. What does that sound? You're a physician. You should have never told me that. I like to pick on physicians. You were here yesterday. This was Dr. Ibrahim. You are Dr. Osama? Hossam. Okay. What does that sound?
It's from the mic.
Okay. Sorry. So you can put applesauce in there, you can put pudding, you can put medicine in there, so use your imagination. So yesterday we talked about how you have to be very intuitive and very imaginative. Are you sure you're ready? And so I'm the patient. Okay. And so you're going to step by step tell me.
بس حابة أتكلم بالعربي ما بالإنجليزي بالضبط. بس أنا راح أتخيلها إن هي أمي، لأن أمي فيها زهايمر. وهي ما تحب طبعا مرضى الزهايمر ما يحبون ينظفون نفسهم إلا إذا كان أحد وقف وياهم. ويخافون من دخول الحمام. فأنا كل يوم أدخل وياها الحمام، أعطيها الفرشة. أعطيها الفرشة، أقول هي ما هذا أنا واحد وأنت واحدة، شريت لك جديدة عشان تنظف حلجك ويصير حلجك ريحته حلوة ونظيفة. تشوفوا روحك في المنظرة. بعدين أنا يعني بقول لكم شنو أسوي يا أمي يعني بالضبط. تشوفوا روحك في المنظرة، يما أنا وأنت أنا مثلك حلوة وأنت مثلي حلوة. تضحك وتسوي معي ونقسم ونخلص. خلصنا من تنظيف الضروس. هنا حق الدواء أخذ نفس الشيء، قفشة الدواء سواء مشروب أو حبوب. الحبوب ما أعطيها إياها في مجموعة 5 أو 6، أوزعهم على فترة. أجيب لها واحدة أقول هي يلا يما هاي الحبة ترى تقويك، تخليك تحركين، تنشطك، يلا خذي واحدة، أخذيها تأخذ. ساعات تتعاند أقول لها أوكي ما تبينها أشيلها، مرة ثانية مرة ثالثة لين تأخذها. بعدين أي حق الأكل مثلا أي أكل هي تحبه، الحين هي ما تاكل اي شيء ما تحب، احط لها موسيقى، هي تحب موسيقى. الحين قاعد اطلع الدكتور، احط لها موسيقى اللي تحبها واقعد وياها واكل وياها واحط لها كذا نوع، ما احط لها نوع واحد، على الاقل لو تاكل قفشه من كل اكل تحبه ويكون ملون تاكل شويه، المهم انها هي تاكل يعني. هاي الطريقه.
Oh nice. Thank you. So she's making it very creative. Okay. So having a microphone. And so she is making it so creative, and she's an integral part of the process. Okay. I need your instructions. Yours? Yes. And show. It's okay. It's okay.
في البداية أعتقد
Go ahead.
في البداية أعتقد أن لازم أعرف المريض هذه شنو. فبس مجرد أن بوصفها أن في عصاية بيضة على آخرها قطعة خضراء. Assuming she doesn't understand the concept. ونحتاج نرطبها علشان نرطب الحلج إذا حاسة بنشفان. فنروح ناخذها إلى تكرم الحمام. أبيش تفتحين الحنفية. آسف. أبيش أبتدي من الأول؟ أوكي. أول شيء بيعرف المريض على هذه، فبس بقول إن في عصات بيضة طويلة ضعيفة وعلى آخرها في قطعة خضراء. تشيلينها علشان نبي نرطبها ونستعملها عشان ترطيب الفم. فيا ريت لو بس نروح الحمام تكتمين، وفي حنفية أبيش تفتحين الحنفية وتحطين هذه تحت الماء لما تصير رطبة، وبعدين مثل ما تفرشين أسنانك أبيش تستعملين هذه في ترطيب الحلج.
And so do you know how he was so specific? He said, I would have to turn on the faucet and hold it underneath the water. Because if you tell someone, go put water on it, go put water on it, you know, how are they supposed to do that? They'll take the teapot and start pouring water on it. So this is very good. You did a good job.
مريض الزهايمر لما يكون ضمن السنجة كان يبدها بأكثر من طريقة، لكن هو كان محدد، نحطها تحت الحنفية ونكتش الماء عليها. ممكن تقول حق المسن نبل هذه، وحسب هي ما ممكن تجيب هو الوقوف فوق الماء أو تحطها في مكان ثاني. تحديد الكلمة، تحديد المكان ومن أين وكيف.
Okay. And so here are some guidelines. The most important thing is to speak very slow and clear.
دائما التخاطب مع مريض الزهايمر نكون بطيئين ومحددين في الكلام. يعني ما نستخدم السرعة في الكلام.
And then you should never argue with the person because they're never going to understand your reasoning.
وما نجادل مريض الزهايمر. إذا بدأ وقت المجادلة ما ندخل معه في المجادلة.
Is it yours? Okay. Stop that. And then always ask for what you want. It has to be very specific. And so we don't say, Mom, brush your teeth and then comb your hair and then come out.
من ناحية الخطوات لازم نكون محددين مثل ما قال الأخ خطوة خطوة. يعني ما نستخدم أسلوب ضرب اسمعني شلون ما ندري أو مشط شعرك شلون. بالنسبة لهم راح تكون صعبة. فالأفضل الخطوات خطوة خطوة.
And we're going to move on to understanding behavior. And so yesterday we saw the picture of the brain, okay, and how the inside of the brain, I had written down normal behavior, and the outside of the brain was abnormal behavior that changes with Alzheimer's.
نتكلم الفترة الآن عن في سلوكيات نفهم سلوكيات مريض الزهايمر نفسه. الأمراض السلوكيات الخارجية لا تتعمق بالداخل والعكس صحيح.
What was the main part of the brain that is affected with behavior and emotion? Who can tell me?
أي جزء من الدماغ اللي تكلمنا فيه أمس مسؤول عن السلوكيات.
Say the back, okay. The frontal lobe, okay. Yes, okay. And so we have a lot of areas that are going to be responsible for the behavior. And so the common sides are memory loss, disorientation to time, people, place.
أعراض اللي نسميها اللي تكلمنا عنها العودة أو الخوف بمعنى صح اللي هي فقدان الذاكرة، عدم معرفة الأماكن والأشخاص، وعندنا مشاكل اللغة نفسها في التخاطب، وعندنا عدم القدرة على التركيز، القدرة على التركيز، وعندنا المشاكل اللي نسميها البصرية في طريقة تقييم الشيء للإمام.
We're having a microphone problem. Are you sure? It's yours? Oh, okay. They're not going to have the ability to concentrate. Okay. And also we talked about the visuospatial perception that they have. Okay. The common behaviors, they will start to walk around. Yesterday we talked about wandering and bad wandering.
من السلوكيات اللي يجدونها في مريض الزهايمر بشكل عام نسميها التجول او التوهان في المكان، يعني يتحركون بشكل دائم حول المكان نفسه.
They're going to want to try to leave, and we've had discussions with some of you about how your mom or grandma, they want to leave the house, or they will ask you to take them to another house even though the one they're living in is their house.
في الشيء الثاني اللي قاعد يحصل الآن يقول إن هذا البيت مو بيت أو هو بيت ودون بيت نعمل المشاكل اللي التواصل، لذلك يؤدي ذلك إلى أن المريض اللي يقوم يتحرك من مكانه يطلع من البيت لأن أساساً هذا البيت مو بيت.
Okay. They will have sleep disturbances, and we talked also about sundowning, and so being able to smoothly transition them from daylight into night.
وعندنا مشكلة في قضية التفرقة ما بين الوقت سواء الليل والنهار، يؤدي في النهاية إلى عندنا مشاكل في نوم المسن نفسه، فتلقى النوم عفوا مريض الزهايمر مضطرب، الليل عنده نهار والنهار عنده ليل، وما يقدر يفرق ما بين هل هو هذا فترة نهار ولا فترة ليل.
Okay. And then on the extreme side, they will start to have delusions, hallucinations, being very suspicious or paranoid. And so sometimes they might, someone shared with me last year that her mom always thought someone was trying to steal from her, to steal her money. And so she would never let go of the purse. Everywhere she went, she had her purse.
ثم ندخل في مرحلة اللي هي احنا نسميها الهلاوس السمعية والبصرية صاحبة لمريض الزهايمر، انه شايف حد في البيت قاعد يكلم احد وانت قدامكم الشخص هذا مو موجود، او يشك الخدامه او اللي في البيت انه باقيين فلوسه باقيين الاغراض الموجوده، وطبعا عباره عن هلاوس سمعيه وبصريه.
And so when you see someone wandering around, as long as they're not hurting themselves and somebody else, it's okay. Okay? Because it's a form of exercise and releasing the energy.
ممكن نستخدم بعض اعراض الزهايمر بما هو يفيده هو من ناحيه ثانيه، ان كل مره اولها اللي هو الحركه الزايده في البيت بطريقه غير محدده. اذا كانت الطريقه غير مؤذيه لاهل البيت يفضل ان يقرا، لان هذا يعتبر جزء من التمارين اللي هو قاعد يسويها بشكل انه غير محدد.
And when we see someone that is what we call sundowning, how do you say sundowning in Arabic? Okay. غروب. Okay. And so when we see someone sundowning, we need to think to ourselves they are tired. They're extremely tired. And I need to think of a way to get them to sleep. And so even if that means not taking them into their bedroom and having them sleep on a couch, it's okay.
So can you explain exactly sundowning?
And so,
Just the sunset.
yeah, and so it is a process. And so yesterday I explained that if I get tired, I can just sleep right here, right? It's not a problem for me to fall asleep. And after I work, it's very easy for me to leave work, go home, and just go to sleep. But they need more time. And so they will start to be very aggressive and start to have different emotions about it, and they're not going to go to sleep.
من احد المشاكل اللي هي مساله تدرك في مساله النوم، فنتعرف احنا عندنا مثلا فتره الليل هذه تعتبر فتره نسميها الراحه والنوم. مريض الزهايمر بشكل عام ما راح يقدر يفهم المفهوم هذا بمعنى اصح، انما يعبر عنه بحاله هيجان، عصبيه، نرفزه، المقصود منها شنو؟ انه هو تعبان يبي ينام، لكن مو عارف يعبر عن نفسه شلون ينام. فكيف نوثق ما بين النفسين هذه؟ انه هو يبي ينام وما بين يسوي كفاءة. هي تتكلم عن تكنيك استخدام مساله الغروب، ان الشمس لما تبتدي تنزل اني انا ابتدي مع الزهايمر راح نكون داشين عليه، المفروض نتهيئ للنوم، المفروض نعد نفسنا حق النوم عشان نرتاح. فنستخدم تقنيه ضوء النهار وضوء الليل على اساس نعلمه انه بمجرد ما ضوء النهار يخفض ينزل، المفروض انا اتهيئ الان لمرحله النوم عشان انام.
And something else that we also see is rummaging. So I don't know how many of you have experience with this, but they will have a drawer or a bag or a box. And sometimes they're really into it. Okay, Ma, what are you looking for? Just wait, just wait. It's in here. I know it's in here. What are you looking for? You know what I'm looking for. Yeah? And so what harm is it doing to allow the person to continue to gather or to explore?
من احد السلوكيات
No harm.
مريض الزهايمر هو نسميه تجميع الخراجيل. اي شيء موجود يبتدي يجمع كثير، يبتدي مع الوقت يقعد يلعب فيهم، يقعد يدور فيهم. السبب شنو مو معروف، ليش؟ يسالونه شو تدورين؟ شو يعني؟ ما ترد، لكن المساله هي انها قاعده تدور في الامور هذه.
You said there's no harm.
There's no harm in it.
They get frustrated.
And so what is frustration? Is there harm in frustration?
I don't know. I didn't.
You tell me. When was the last time you were frustrated?
No. But we're treating them as different. Is their frustration similar to ours?
It is a frustration, and so it is an emotion. But we feel different, okay? Me and you, we feel different because we can't really help them. We can't tell them, I don't understand what you're looking for because it's not in there.
No, that's not mine. when we get frustrated because we're not finding anything,
They're frustrated, and they're
different to when they're frustrated because they can't find anything.
it's the same emotion. They're frustrated equally. So this is a good question. They're frustrated. It's the same emotion, the frustration. Okay, but we always want to help them because we want to tell them it's not in there. The keys to the car, it's not in there. And so what are they going to say when we tell them it's not in there? They're going to think we're lying. And then they're going to get frustrated too. They're going to get very upset, very aggressive. Okay? Yeah, and so sometimes it's better just to allow them to search rather than open up Pandora's box. Yeah.
هنا طرح سؤال، هذا لا يؤدي إلى أن نسميه إرهاق لنا احنا أو توتر أو قضية تدوير الأمور هذه، فكانت الفكرة لا نترك مريض الزهايمر إنه يدور، لأن سبيل طرح مثال لو أن في تدور على المفتاح وأنت تقول المفتاح مو موجود، ندخل في مشكلة جدلية احنا في غنى عنها. فالأصل يترك أن المريض الزهايمر أنه يدور في الأمور هذه كنوع من التدبير الذاتي للشخص نفسه. وراح لكم أنتم هم أنه ما تدخلون في جدال عنيف مع المريض بطريقة لا إرادية. هي مع الوقت شوية مجرد ما أمور تهدى تترك الأمور تقعد على مشروع في أي مسألة ثانية.
And so the last thing is resistance. Sometimes when you have resistance and the person does not want to go somewhere, does not want to do something, it's also a sign, it's telling you something. And so it may be telling you that they're feeling uncomfortable or they need a change, okay? A change in environment, a change in activity, okay?
في عندنا مسألة المقاومة كذلك، يطلبون شيء منهم هم يطلبون ويستمر مسألة نطلع برا لا ما نطلع، نروح مكان فلاني لا ما نبي، ندخل في مسألة جدال. هي الفكرة عبارة عن التعبير الموجود في الداخل إن في شيء اللي يمنعهم من الخروج أو تغيير.
Yeah. And so yesterday in the morning I said that this type of a lecture is very different than when people talk about the theory of Alzheimer's, the research of Alzheimer's, because this is very clinically practiced in the healthcare setting.
هي الفكرة أن الورشة هذه ليست ورشة علمية بمعنى علمية، يعني احنا ما نتكلم في الألزهايمر في الدراسات والأبحاث، أكثر ما احنا قاعدين نتكلم شلون نتعامل مع المريض بغض النظر عن الدراسات اللي قاعد تصير حوالينا وطرق العلاج الطبية والعلمية له. يعني نتكلم ما هو اللي نقدر نسويه أثناء تواجده معنا داخل البيت نفسه.
And so you always treat the person, not the disease.
لكن نعالج الشخص وليس المرض.
Okay. And so you have to know the person. And so this is a little cartoon clip that I found from a website from India. And so it says, what is she saying? Yeah, Emma, stop putting ketchup on your ice cream. Okay, Emma, stop. What will people say? And then she's saying, don't shout at me. Because she doesn't understand that it's kind of disgusting, if you will. Maybe some people like it, but putting ketchup on your ice cream. What are people going to say? Stop it. And she's taking it as, I don't know what's wrong with putting ketchup on the ice cream. Why are you yelling at me to stop?
عادة مريض الزهايمر يحصل منا بعض السلوكيات غير مستساغة منا نحن أنفسنا. يعني هي ضربت المثال هنا إن مرة كبيرة في السن قاعد تحط الكابوس فوق الآيس كريم. بالنسبة لنا سلوك مستهجن. الفكرة أن السلوك المستهجن هذا يؤدي في النهاية إلى شنو؟ إلى جدال ما بين اللي قاعد يضع مريض الزهايمر وما بين الشخص اللي معاه مريض الزهايمر. الفكرة كلها أن السلوك المستهجن هذا بعض المرات لأن الشخص نفسه ما يعرف كيف قاعد يتصرف فيه. فما الأصل نستوعب السلوك هذا من غير ما ندخل في نقاش خاص.
Okay, and so the behavior becomes a problem when it violates other people, okay, or when it becomes unsafe for either the caregiver or for the person with the disease.
الفكرة الأساسية إن نرجع لنفس النقطة، دائما نرجع لنقطتها الأساسية. يترك مريض الألزهايمر في التصرف. متى يمنع التصرف؟ إذا تدخل في حرية الناس الثانيين أو أثر على حرية الناس الثانيين حواليه أو إذا كان خطر على نفسه. ما عدا ذلك له كثير التصرف.
And so what are some changes in the residents' or the person's health and comfort? They can have fatigue, constipation, some type of health-related illness, depression, and physical discomfort. So you have to understand what's going on with them.
السلوك اللي يطلع مع مريض الزهايمر اللي قد يكون غير متقبل لنا قد تكون له دوافع. قد يكون لها دوافع احنا نسميها اللي هي مرضية، مثل الامساك المزمن، او يكون في حاله مرض، او احتمال يكون معاه اكتئاب، او ان الجو اللي حواليه بارد حار مو مرتاح البيئه اللي يكون عايش فيها.
And then also the environment. We talked yesterday about how a room could be too cold, too hot, too big, too small. It could be too noisy, or maybe the person likes just a little bit of background noise, just a tad bit.
أو قد يكون بيئية، صوت التلفزيون العالي، خاصة اللي يكون مبلل أو يكون في قطع أثاث موجودة في الطريق أو تعطي نسميه الوهج اللي يخليه مضايق، هذه أسباب كبيرة.
Okay. Or they might have a problem with the task, and so last year when I came, someone from I forgot what school, and I forgot to bring it, but they made little tiny pictures in a book of how to brush the teeth, step-by-step pictures. And so that's going to be very helpful for them to understand the process of brushing the teeth. Okay.
قد يكون سبب السلوك موجود عدم فهم نسميه السلوك اللي يعمل تنظيف الأسنان، أو أنها راح تتسبح، هي مو فاهم الفكرة، فيؤدي هذا إلى سلوك مضاد للشخص نفسه. يعني هي ذكرت قصة المثال أن في واحد عنده كتاب وضع صور في تنظيف الأسنان على أساس يعرض كبار السن، بس المشكلة أن الصور كلها صغيرة، في مشكلة بالنظر، فأدى هذا إلى هيجان كثير. السبب أن الصور صغيرة.
Okay. And then there's also a cues and clues model, and so you have to understand who the person is, what is the behavior that's concerning us, because the behavior has to be a concern, right? And so we can't nitpick on everything, and so we have to pick this behavior that we think is going to cause the patient or the person harm or discomfort.
نرجع لنفس الفكرة اللي هي أن سلوك مريض الزهايمر إن ما نكون يعني دقيقين في كل سلوك، إنما نتخير السلوك اللي بالفعل يؤدي إلى ضرر للمريض نفسه، أما عدا ذلك السلوكات نترك على ما هو عليه.
Okay. And then quality interactions are pivotal. You have to acknowledge feelings. And so if someone is crying, you have to acknowledge that they're crying. Okay?
دائما نتعامل مع كل السلوكيات برد فعل ما هو مناسب لسلوكياتنا. يعني مو كل رد فعل مقابل رد فعل معاكس، انما بعض المرات نتفاعل معه وبعض المرات نتجاهله.
Okay. And so we're going to okay. And so this is from patients that are saying this. They're saying, when I forget, either laugh with me or hug me, but please don't try to make excuses for me. When you do that, it makes me feel very angry, and I feel that you do not understand what I'm feeling.
هذا أحد الكتابات لكبيرة السن أو مريض الزهايمر يتكلم فيه بالفقرة الأولى، يقول لك لما أنا أنسى لا تجعلني عذر، إنما يا إما تضمني أو تضحك، فأنا أفهم إني أنا نسيت.
Oops. Whoops, whoops. There we go. Okay. We're going to move along just so we have time for the activity. And so everybody that is here is a caregiver, okay? And so maybe you don't have someone with Alzheimer's disease in your life, but you will at some point be a caregiver. You may care for someone with a cold or the flu or respiratory illness, but you are all a caregiver.
يطرح فكرة أن المفروض يكون مسؤول عن الزهايمر مو شخص فقط، يحاول نشط العيلة يضع كل المسؤولين عن الحالة هذه الكل يتفاعل مع الخدمة.
Okay, and so who are the caregivers in the United States? They are unpaid. It's usually majority of them family, friends, neighbors, children, and parents.
هي تفرض مثال تضرب مثال في أمريكا قائمين بخدمة حالات الزهايمر غير مدفوع لهم الأجر، يعتبرون اللي هم الأهل، الأقارب، الأبناء، الأقرباء من الدرجة الأولى، هذول اللي ممكن يقدمون.
And so here's some statistics that in the UK, 6 million people provide care on an unpaid basis for someone that they know.
في آخر إحصائية لسنة 2001 تم تعداد 6000 خدمة غير مدفوعة من أجل حالات الزهايمر.
And then in the US, it's 61.6 million people. 61.6. You know, the healthcare sucks in the United States. I hope you get that on the video camera. And so when someone is sick, you cannot afford to bring someone into the house to care for them. And so you rely very heavily on daughters, brothers, neighbors. And yesterday we had the example of our neighbor Jack, who my mom is basically watching him while his wife goes to work.
الولايات المتحدة الأمريكية على الخدمة الصحية المطورة عندهم يعتبر تعداد مقدمين الخدمة عندهم اللي هو 61,000 مقدم خدمة، اللي لا يتناسب مع عدد الحالات الزهايمر. لا يدخل مليون عموما يدخلون، ففي ناس غير مسؤولين عن هذه الأقارب. فهي ذكرت مثال أمس أن جاء كان مريض الزهايمر وكان مقدم خدمة.
And also, when they put the person into a nursing home, still the family cares for them. Okay?
حتى الحالات الموجودة في دور الرعاية دائما الأهالي.
And so I urge you to figure out what spikes in the population you have here in Kuwait. You know, your baby boomer phase. How high is it, and when is it going to peak? I don't know that. Do you? You know? Is it already at its peak?
No, still we are less.
So you're getting ready for it.
We are getting less.
Good.
Still the young nation.
Yeah. Okay. And so usually what happens is your role changes and you become, here we have a primary family, like the husband and the children, and then you have tertiary family, grandparents, in-laws, aunts and uncles, and then secondary family, mother, father, and siblings, who all end up being a caregiver.
هي نرجع نفس الفكرة الأساسية اللي يعتبر الكل المفروض يشارك في تقديم الخدمة، مو بس الابن أو الابنة، ممكن الأبناء يشاركون، ممكن الأقارب يشاركون في تقديم الخدمة كلها. الفكرة الأساسية في الموضوع هذا أن مريض الزهايمر مو مفصول عن المجتمع، هو عايش في المجتمع، وكل اللي حواليه هم يفهمون سلوكه ومش عارفون شلون يتعاملون معه.
And so how many people feel like this? You're the one in the middle. Nobody? I feel like that. Work, school, family, you know. And then if you have to take someone to the doctor's office, you're like, there's only 24 hours in a day. And so we also have what's called the sandwich generation, people being sandwiched. Okay. And so this is caregivers in the middle stages of Alzheimer's disease, because remember, this can also be a long period of time. Okay.
شلون نبتدي نرتب حياة مريض الزهايمر لما يدخل في مراحل متقدمة، في المرحلة الخامسة والسادسة والسابعة. فلو احنا عندنا يكون مجموعة سبورت نسميها في المراحل الأولى والثانية والثالثة، ويحصل بينهم التواصل، شلون المجموعات هذه بتؤثر بنوعية الحياة لما يدخل في المراحل المتقدمة.
And so it would be helpful to find a support group, even if the group is not as big as this type of group, if you have some type of a support network, even in the family.
تكوين مجموعات لها دعم، ان كل مجموعه تساند المجموعه اللي يمها والمجموعه اللي جنبها، تتوزع المهارات كلها عشان تقدر تخدم الزهايمر بطريقه صح.
Okay. Understand your daily plans as well as theirs, because you cannot put your life on the back burner. Okay, that's where we start to get very stressed out.
تطرح فكره اساسيه هي ان انت المسؤول عن مريض الزهايمر، لا تستهلك حياتك تماما لمريض الزهايمر، لازم يكون في شخص يعينك في الموضوع، انت المفروض يكون عندك فترات راحه وفترات اللي تستعيد في نشاطك، يعني انت المفروض ما تستهلك نفسك تماما مع مريض الزهايمر، لذلك هذه فكره السبورت جروب، انه يكون في عندك مجموعات تساندك، انت تاخذ بريك، الشخص الثاني يساند في الموضوع، الثاني ياخذ بريك، الثالث يساند، فهي الفكره لما نعرف انه يكون ان المريض الزهايمر مو بس شخص واحد يعتني فيه، انما كل افراد العائله، حتى انت لا تستهلك وتصبح انت العائق لمريض الزهايمر اكثر من الزهايمر.
Okay. And then we talked about stage 7 of Alzheimer's, and you have to understand that no matter what your doctors say, that Alzheimer's is going to end up winning if they don't end up succumbing to some other disease.
دائما نعتمد على خبرتك الذاتيه مع مريض الزهايمر، لا تعتمد لا تعتمد على راي الطبيب في طريقه العلاج، انت اعرف عن مريضك بتقديم العلاج، الطبيب يعطيك الخطوات الاساسيه ورؤوس الاقلام، لكن الذي يحدد طريقه العنايه بالضبط هو من قائم مو راي الطبيب، يعطيك بس رؤوس الاقلام.
And so it's very easy retrospectively to say, I should have done this, I should have done that. You know, did I do enough for my mom or my dad? But you have to know in your heart that you did all that you could do for your loved one, right? Because if you didn't, you wouldn't be thinking those thoughts.
هي تطرح فكره اني لا تشعر بعقده الذنب اتجاه العنايه اللي قاعد تقدمها لمريض الزهايمر. لو انا سويت كذي ممكن يصير كذي، او ممكن اقدم له بطريقه كذي، لا، تطمن واطمئن تماما اللي قاعد تقدمه هو اللي هو قاعد يتم بطريقه سليمه. حتى لو اخطات في جزء منه، ممكن كنا قلنا في بدايه كلامنا الخطا والتجربه يعلم الموضوع هذا، ولكن لازم تثق بنفسك ثقه تامه انك انت قاعد تقدم كذا، وليس تقصير فيه، انما لا تشعر بعقده الذنب.
And so at some point, you as the caregiver, you need to take yourself out of the caregiver role and be a daughter, a son, a granddaughter, okay? And so you need to spend some quality time other than turning the patient or the person, cleaning them up. And so sometimes this is even when they fall asleep, you go into the room and you hold their hand and you just sit there quietly just thinking about them and thinking about the future and thinking about the past and how it was having them part of your life being very active.
عيش حياتك، لا تعتمد على مريض الزهايمر. إذا أنت تعيش حياتك كلها مع مريض الزهايمر، أنت تشوف مريض الزهايمر معه، تعيش معه، شلون هو يعاني، شو الماضي اللي كان فيه، وليش هو صار كذي، وليش تطور كذي، لا، أنت قاعد تعامل مع مريض الزهايمر كفرد من أفراد العائلة، يعني اعتبر مثلا يدخل المرض، في راح يطلع من المرض، وإذا كان مرض مسلم لازم أنت هم تعيش حياتك وتخليه هو يعيش حياته. لا تغلق نفسك مع مريض الزهايمر، دائما شخص ثاني يشاركك في الحياه او يشاركك في العنايه بمريض الزهايمر، وانت تعيش حياتك العاديه تماما.
Okay, and no one is Superman or Superwoman, super daughter, super anybody, and so you will need help, especially towards the end of the stages. You cannot do it by yourself.
ما تستطيع تعمل زي الوقت الأصل، لا نكون مجموعة نسميها دعم أو اللي هم اللي يساعدون في الموضوع هذا.
Explain Alzheimer disease to the kids. Sometimes they get afraid that it's an inherited disease or
Yeah, and so we'll talk about that in the end. Okay, remind me during question time. Okay. Okay.
هي سألت سؤال جميل، أن كنا المفروض نشارك كل أفراد العائلة في الموضوع، العيال الصغار شلون؟
The best children are the best people who can deal with this.
Yeah. And you know the person better. Yeah. And so this is a very nice story that I found on the internet at one of the websites that are just for people with dementia and Alzheimer's. And so this is the husband who's saying, I became a caregiver August 2009 for my wife. And they look really young. They look like they're in their 40s. And so she was diagnosed after a series of tests with the physician with early stages. They always take care of each other because they're husband and wife. And he says, I'm not a caregiver because she has the disease. I'm the caregiver because I'm her husband. And then you see that he's saying that he gets stressed out thinking about it, which happens to a lot of us. And we're thinking, okay, you're okay now, you're forgetting a little bit of things, but what's going to happen when you can't walk, when you can't eat? How am I going to deal with that?
هي تشرح لي قصة، هذه القصة الحمد لله في مجتمعنا هو دائما مجتمعاتنا تعتبر ممتازة نسبيا، في عندنا اللي هو الإخوان والأعمام، وفي عندنا اللي نسميها الجوارة يوم الخميس والجمعة. دائما في الأسر اللي نسميها الخلوية أو الخلية عبارة عن زوج وزوجة هم شايلين بعض بس. فالفكرة كلها أن الكل يشارك في العناية في مريض الزهايمر والكل راح يساعد فيه. بينما في القصة هنا أن الرجال زوجته اللي كانت في الزهايمر هو الوحيد اللي كان قائم فيها طول فترة التطور.
And so here you have someone that says, I'm just a little bit stressed right now. And this is what they look like, just a little bit stressed. And then he's saying, just turn around, leave quietly, and no one is going to get hurt. Okay? And sometimes we think that, I'm just a little stressed out right now, and I just need to go and take a break. This is a tree. This is a wonderful thing to try to do. It's they call it like a thinking tree. And so all the different things that you can do to manage the stress.
هذه خريطة عن كيف تتعامل مع القلق مع التوتر والقلق. ما حسبت إن الموضوع أسهل جدا.
Okay, and so this is a caregiver stress checklist, okay? And so you just simply say yes or no. Okay. Do you feel like you have to do it all by yourself and that you should be doing more?
راح تطرح الحين مجموعة أسئلة جواب راح يكون نعم أو لا. أول سؤال راح يكون هل أنت ملزم إنك تكون مهتم بنفسك أنت وإنك المفروض تجيب الخدمة هذه؟
Yes? No?
هل أنت المسؤول الوحيد عن الزهايمر؟ وأنت المفروض توديه كل الخدمات تطور لك الخدمات بروحك؟ يقول إيه ويقول لا.
Yes? Yeah. I always say yes. Sometimes I say yes. Okay. Do you withdraw from family and friends and activities that you should enjoy?
هل تنسحب من كل واجباتك اليومية تتفرغ لمريض الزهايمر؟
Good. Because you shouldn't. You should still enjoy that because it's still your life that's going on. Okay. Do you worry that the person you care for is safe? So you. Yeah. You go to work, you go to the grocery store, you fill the car up with gas and you're still thinking about them. What are they doing at home? I hope they don't fall.
Does it consume your thinking? يعني السؤال مقصود فيه. هل هو يستهلك تفكيرك؟
Yeah. Do you feel anxious about money and healthcare decisions? No. Here, I found that out yesterday. Nobody should feel anxious about that. Do you deny the impact of the disease and its effect on your family? No. Okay. And so this denial is very bad. Okay? Yes. Because as the disease progresses, you will not be ready for it. Do you feel grief or sadness that your relationship with the person is not what it used to be?
هل تشعر بالحزن والأسى عندما يجد أن الشخص
Not yet.
ولا هذا قضاء قدر؟
Yeah. And so for those of you that say yes, it's probably because the disease has progressed. Okay. For those of you that said no, has the disease progressed? And that's why. Okay. So you can still appreciate a lot of what's going on.
Actually, sorry, it depends on your interpretation. For example,
Wait, I can't hear.
it depends my or your interpretation of the patient behavior. For example, as if you are caring, loving, you are very warm, you worry about, you could say, but sometimes he's very animus. There's animosity, there is violence behavior against you. But you have to know that this person, this is not his nature.
Exactly.
He doesn't mean it.
Yes.
He's out of control.
Good. That's very good. Yeah. And so don't take their behavior as something against you. Okay? Because they're not doing it on purpose.
لا تعتبر سلوك مريض الزهايمر هو شيء ضدك. لا هو عبارة عن سلوك. هو يعبر عن نفسه.
Okay? And do you get frustrated or angry when they keep repeating something or they're not listening to you?
تجعل تعصب لو انك كرر الموضوع اكثر من مره كيف تتبع علي يحلف في الموضوع انت تتنفس.
Yeah. And do you have health problems that are taking a toll on you? And so you remember, you can't forget that you're a person too. You have your own life, okay? And you may have your own health care issues, okay?
لو قلت مع مصاب بامراض هل تهم الامراض عشان بس تعتني في مريض الزهايمر ولا تعتني في امراضك كلها؟
But she said it's very true. You have to take care of yourself.
Yeah.
Be able to take care of others. If you are weak, you can do it.
نرجع لعقدة الدم.
And so here's another map, okay, of ways to alleviate the stress. And so if you answered yes to any of the questions, you may be experiencing signs of caregiver stress or caregiver guilt. Okay, and then so we're in our last section here. And so we're going to talk about how you need to take care of yourself, okay? And so the ideal goal is to manage stress because that's what we're feeling. Stress is like a whole ball of different emotions, okay? And so avoid being overwhelmed and avoid neglecting yourself.
ولا تنغمس كل حياتك مع مريض الزهايمر بحيث انك تحرق نفسك عشان مريض الزهايمر.
Yeah. And a majority of the people get very stressed out because they don't understand the disease first. And so yesterday we talked about steps or stages 1 through 7. And so all of you should know that it's going to progress. Okay?
الفكرة الأساسية دائما نفهم المرض إن المرض هذا عبارة عن مرض متطور ولو إن ممكن مع الوقت يسوء يعني ما نخلي أفكار وردية في الرأس إنه ممكن بعد يتحسن خلاص لكن لا يتقبل المرض ويعيش معه ويمشي في الخواطر.
Okay. And then you have to get help. And so trying to do everything yourself is not a sign of strength, it's a sign of weakness. You're weak. You can't allow someone to come in and to help you. And so you have to allow someone to come in. You can translate that before I go into my story.
الفكرة الأساسية اللي أصلاً سببها كان ورشة العمل هذه اللي عنده مريض الزهايمر ما يفشل لنفسه إنما يطلب المساعدة بكل الطرق الممكنة. يشرك الكل فيه سواء جهة طبية، جهة خدمة اجتماعية، سواء مؤسسات نسميها نفع عام، يحاول يشرك الكل إنه يساعده في إنه يعتني في مريض الزهايمر معه. إنه ما يحاول يخش عنده في البيت وإن هذا شيء خاص فيه هو بس هو المفروض يعتني فيه، إنما يظهر للناس كلها. المفروض الكل يشارك ويفتخر والله أنا عندي مريض وأنا قاعد أشارك أحب حد يساعدني حتى أكسب الخبرة لغيري.
I love this picture because it's the stripes falling off the zebra. I think it's stress. And so last year I had the unfortunate pleasure of meeting someone whose mom was in the end stages of Alzheimer's, and she came during the last day of my lecture towards the end, and she was very nervous and frustrated, and she was basically losing her stripes. And she came to me wanting help, but it was almost like it was too late, that you really could not help her, because every time we gave a suggestion, she turned it down.
تتكلم عن خبرة السنة اللي طافت لما هي تقدمت ورشة عمل، جتها واحدة من طوال أمها كانت مصابة بالمرض، وما كانت المرحلة الأخيرة اللي كانت تقدم اقتراح، اكتشفت أن صاحبة اللي قاعدة تقدم الخدمة هذه داخلة في فورم يقول لك حق الداخل، يعني وصلت من أمها لمرحلة أنها خلاص ما يعني استوفدت تماما، فكانت هي تقترح عليها اقتراح وهي ترد الاقتراح، تقترح الاقتراح وترد الاقتراح. فهي اكتشفت ان هذه الحاله ان هي ما طبقت الفكره اللي نتكلم عنها، انها ما شاركت احد في الموضوع وكانت تضم لها هي بس، فهذه المشكله اللي المفروض تنحل ونطلع منها.
Yeah. And so she was in her own little bubble, okay? And her mom were in the bubble, and we're all on the outside, wanting to help her and her not wanting to let someone else in. And so what can stress do to you? You can have visual problems, you can have stomach irritation, high blood pressure, changes in your overall behavior. Very irritable, you can't concentrate, you don't want to eat too much, or you eat too much and you gain weight.
ودائما نقدم الخدمه يدخل في مشكله نسميها التوتر. التوتر في النهايه يؤدي الى امراض. انت تمرض من وراء التوتر. تدخل في حالات اللي هو الامساك، القولون العصبي، انخفاض الدم، زياده وزن، نزله وزن، بسببها شنو؟ عباره عن توتر من البدايه اللي كنت منغلق فيه مع مريض الالزهايمر فقط.
And so, what makes you happy? What makes you happy?
Sports.
Sports? Playing. What makes you happy in life? Swimming? Yeah. Oh, nice. What makes you happy?
Traveling.
Traveling.
Make
other people happy. What makes you happy? Work. What do you do? Wrong. But other than work. What makes you happy when you leave work? She's a workaholic. When you leave work, what do you do? Sleep. We'll come back. Think about it. Huh? The spa. Good. What makes you happy? Yeah?
Her work.
Oh, your work too? Oh, God. We're going to have to talk with you guys later. What makes you happy?
الناس ما صدق أولادي.
Okay. All right.
شنو يعني؟ شو اللي
ينبس.
سعيدة. Shopping.
What is shopping? Is safar. Good. And what makes you happy? A cup of coffee with a book. That's very simple. And it's your way to be alone in your thoughts. Yeah, this is very true. And so we're going to go through, denial is very bad. Anger is also very bad because you're getting angry at something that nobody has the power to change. Social withdrawn and anxiety, being anxious.
نتكلم عن الشغلات الكومن اللي دائما تظهر اللي كانت عندنا النرفزه والعصبيه، عندنا الخروج من الانشطه الاجتماعيه والانغلاق على الذات نفسه، التوتر من اي شيء، العصب والنرفزيه من كل شيء. هذه كلها اعراض توتر قائم بالخدمه، يعني هذه عباره ليست امراض سببها التوتر الحرج نفسه مع مريض الالزهايمر لدرجه بدات تظهر فيه الاعراض. كيف نميزه بالاعراض؟
And so how do you manage the stress? The first thing is that you have to accept the changes as they occur. Okay, and now we all have a foundation of knowledge, okay, and so you're going to have to accept the changes as they occur. You can start to get the financial things in order because it's really hard after the person passes away to start dealing with finances.
Our society here, which is different than in the States. In the States, sometimes there's just one person, for example, the husband who's taking care of his wife. Here we have totally the opposite. There is a good relation, big families here. So you might have many or different persons in the family who interface to take care of that patient or the elderly with Alzheimer. So you have a lot of suggestions, ideas, and that's the load and the stress of the caregiver. And interference.
So it's very different.
To our society.
Yeah.
Can you imagine if the son would say, let's give that medicine, how about taking her to that doctor, not to...
And it's very difficult because, in the U.S. it's, we usually have one person that is responsible for the care. And so I have 2 other siblings, but I am the one who speaks on behalf of my father and my mom. And so my other 2 brothers cannot interfere.
That's why, for my own experience, sit at the beginning and define the role.
Exactly. And so sometimes it does it come to a cultural change, you know. Yeah, hopefully. Yeah.
طرحت نقطة هي قد نختلف فيه مع أمريكا اللي هو من المسؤول عن الحالة ومن صاحب القرار في الحالة. عادة احنا عندنا هنا أسرنا أسرة كبيرة اللي ممكن يتدخل في الحالة الأخ أو الزوج أو الأخت أو الخوات، ففي أكثر من واحد صاحب قرار. فأحد أنواع نسميه التوتر الحاصل هناك في مريض الألزهايمر إن ما عندنا شخص واحد هو صاحب القرار في الموضوع، إن المفروض الأمور ترجع له هو، إن الكل هو المستشار في الموضوع والباقي يساعدونه. نفس الإشكالية في أمريكا لكن بطريقة مختلفة تماما، إنهم عندهم التزامات مالية والتزامات أسرية مختلفة تماما. فهي طرحت نقطة وقد يكون هذه يمكن نتناقش فيها بعدين اللي هي فكرة إذا عندي مريض ألزهايمر من المسؤول عنه؟ والمفروض اللي يساعد في الموضوع.
And then lastly, do not feel guilty. We all try to do our best, okay? We try to do as much as we can. And no one is going to look down on you or say, you know, you didn't do enough. I mean, in the end, it's inevitable how the disease is going to progress, okay? And so also, we're not going to go into depth about follow-up, but you have to make sure that the same person goes with the patient to the doctor, or that you keep following up with the same doctor, and that the person does not get lost in the healthcare system.
تكمل الكلام السابق انه يفضل ان شخص واحد هو اللي يتعامل مع مريض الزهايمر يكون يتعاملون يفضل ان يتعامل مع طبيب ولا ينتقل من طبيب لثاني لان الطبيب مع مرور الوقت ومقدم الخدمه يبي يفهم المريض بطريقه افضل بغض النظر حتى لو في طرف ثاني عنده تطور او شيء ثاني لكن يفضل انه يكون نسميه استمراريه مع شخص واحد في التعامل حتى يكون عندنا
Okay, and so now we have this wonderful activity, but can someone help me pass these out? Do you mind? Everybody gets one of these bags. So everybody gets one of these.
I will not carry the bag. I'll carry this easily like this. Okay?
Yes, yes. So everybody gets one. And here's 2 more. So here's it. See, it was quick.
Yes.
Yeah, thank you. Okay, so don't look in the bag yet. ما تفتحوا. Okay. Yeah, the candy, which I ate maybe half a bag yesterday. Okay, and so this is a summary of yesterday, okay? Okay, here.
اللي موجود في الكيس عبارة عن اختصار نسميها اللي هو التدريبية.
And so these are yours, you can take them home, okay?
When we give you one, we can.
Huh?
This is the same.
Yeah.
حد ياخذ كيسة معاه يمكن ها؟ اللي ياخذ كيسة معاه.
Yes, please, I don't want, my luggage has to be a certain weight. Okay, and so yesterday we talked about gross motor, okay? So we talked about how the patient will have difficulty moving their upper extremities and their lower extremities, difficulty walking, difficulty seeing, difficulty swallowing, difficulty hearing. All these things happen, okay?
تكلمنا امس عن الاعراض اللي تطرح من الزهايمر سواء حركيه او حسيه فيها معنى صح، عنده صعوبه في الحركه، عنده صعوبه في تحريك الاطراف، عنده صعوبه في النظر، عنده صعوبه في السمع بشكل جيد، فهذه كانت راح نتكلم فيها بشكل مختصر عن الصعوبه هذه الموجوده.
Okay, just one moment, please. So the first step, the instructions are here. And so just please help the person next to you read the instructions. It's supposed to be confusion, the background sound. Yeah? And so you can start. You have to put your glasses on first. Put your glasses on first.
Glasses and gloves, right?
Glasses and gloves. And so you have to take your glasses off. You have to take your glasses off. Off. Put these glasses on and take these glasses on, those off.
What I'm supposed to see?
Put them on, and now read the directions and do them.
What if I need my other glasses?
Nope. So هاي النظارات لازم لا بتشوف لازم تشوف لازم.
إذا لابسين نظارات طلعوا نظاراتكم والبسوا النظارة السوداء. طلع النظارة والبسها من غير نظارة. البسوا النظارات.
يا بعدين بتكرهي.
وين هذا؟
Yeah, yes you can. The little hole you can see through. Yeah. Yes. Focus. Yeah. Okay. Yeah? In your mouth. Yeah. All of it. You put all the candy in your mouth. And so where it says put the candy or the gum in your mouth. You said no. Why? Why? Why can't? Put the glasses back on. Put the glasses back on. Put them on. Now, why can't you do it?
I have a problem.
You have a problem, so.
You mean this is the plastic?
Yes, and so you put this in your shoe.
What if I'm wearing a sandal?
You can put them. You can still.
Actually, I am wearing a sandal too.
And you can still put the corn in your shoe. The whole bag. Just put the bag in your shoe. One bag in each shoe. They shouldn't yet. They usually won't say, I can't eat the candy. Yeah.
Sometimes they
Yeah.
do the other.
Yeah. I found out from the other classes that if they're diabetic, they just won't do it. Yeah. It was hard to find diabetic-free caramel or gum that makes them. How do you feel? Do you have candy in your mouth? You put them in there? Yeah? Okay. She's diabetic? Maybe her sugar dropped during the class. So maybe next time I should give them a quarter tablet of glucophage. Yeah. How did you feel?
Awkward.
It was awkward. Yeah. Bring me your paper. Do you have corn?
Can't see.
You can't see? So cute. Look at Oh my God, I love this. I love it. No, with the corn. With the corn. How are you feeling?
How am I supposed to feel?
How do you feel? You tell me.
A lot of fun.
No fun? Or it was a lot of fun? Can you hear me okay?
Yeah, I can.
You can hear me? How about the sight?
Yeah, I can see it.
Yeah?
I can
Okay.
see it now.
Okay. And then the shoes. Wait, you have it on the... Oh, okay. Okay.
Is that correct?
Yeah, it is. Yeah. Okay, we'll talk about it in a little bit.
Okay.
Yeah, thanks.
Can I take this
You
off?
can take them off. Yeah. How are you feeling?
I see little.
A little bit?
Yeah, there is a little bit, yeah. إذا وقعت اتكسرت راح أدفع.
You almost fell, right?
This is how disabled the
Yeah,
Alzheimer.
disabled. Yeah. How are you
I
feeling?
have the corn in my shoe. Is that what you wanted?
Yeah, the corn in the shoe.
صح؟
Yeah, صح. Thank you. Okay, this looks very nice. Those glasses look really nice on you. Yeah. How are you feeling? You feeling okay? Yeah. You're so cute. Keep Hassa. It's very disruptive. Yes. Yeah. It's very disruptive.
Is this how they see?
Yeah. That's it. Things can start to get very, so we forget about the vision, but sometimes their vision is like that. They lose peripheral vision.
And what's the idea with
The corn is the discomfort. And so if you really put it on the ball of your feet, like here, it's very uncomfortable to walk. And so they might be feeling discomfort from their shoes, from pain. And so the way that you're walking, that's how they're feeling. Yeah?
This is mine and this is my neighbor's.
Okay.
She's cheating.
Thank you.
It's very sweet.
Yeah. Thank you. شكرا. Thank you. كيف حسيتي؟ حطيتي الذرة؟ حطيتي الذرة؟ لا
أنا أشوفها مسيجين.
طيب تقدري تكنيهم. Yeah, she's so cute. She didn't put corn in her shoes. Okay. Oh, thank you. Okay. So we're going to finish up now the class. And so what did we have here? We had the gloves. The gloves for what?
To wear it.
Yeah. To wear them. Yeah. So we have decreased sensation. Yes. Sense of touch. Okay. The corn in the shoe was for what? Difficult walking, off balance. Good. Good. The glasses. Difficult in seeing. Okay. And so you tend to look a lot like this. Okay. And so we all know what these were for.
Yeah, for decreasing.
Okay. And so what about, sorry if somebody is diabetic, I apologize. But what was the caramel? You were supposed to put all of it in your mouth. Mm-hmm. And so what was, because you can't swallow, too much saliva, okay? And you almost don't want to talk to anybody because you might start to drool, okay? And so what about the background music? Because this is disturbing.
It's like a hallucination.
Yeah. Hallucination.
Hallucination and the whole experience.
Yeah.
Tells you how disabled
here.
Your patient
Yeah.
is. And because people used to be very active, very normal, you don't expect it takes us time as their caregiver or their daughters or sons to accept the fact that they became disabled.
Yes.
In all of their senses and activities. And their interpretation of the world is not as right as
Right.
it used to be.
Yes, that is correct. Thank you. And then even the music that I had on can be like a background noise. And so you might think that the TV sounds good to have in the background, whereas they don't like the TV. And they don't know what it is. Okay? And that's why it might cause them difficulty to complete a task. Okay?
الفكرة ان الكيس هذه يبين العوائق اللي يعيشها مريض الزهايمر. احنا دخلناكم في تجربة شو اللي يشعر فيه الزهايمر بالوضع هذا. رغم ان قلنا الاحساس راح يكون في اللي هو نسميه الدكتور، الاحساس عنده راح يكون ضعيف. الحبات الدورة اللي داخل الجوفي، صوبة المشي اللي يشعر فيه. عندنا الحلاوة اللي تحط مرة واحدة في الثلج، صوبة الثلج الى جانب اللي نسميه سيلان ما بالثلج. النظارات السوداء ضعف النظر تحصل، ضعف السمع. الى جانبه حطت اللي هي الخلفيه هذه هي احساس مريض الالزهايمر اللي حواليه، يشعر بالصوت هذا. فدائما التشويش هذا يكون عنده، وقالت عنها الدكتوره فاطمه اللي هو بعض المرات يكون نوع من انواع الهلوسه يكون موجود اصلا.
Yeah. Okay. And so we're at the end. Question, comments, concerns. If you want to speak to me in person, this is good as well. Yes. And you hold the microphone.
I read once an article that a doctor called Jennifer, something I forgot her name, in Florida University, and she said that one way to detect Alzheimer, the beginning stages, is that to smell peanut butter.
Yeah.
Yeah, really. And then, because it starts first signs with the impairment of the nose to detect the smell.
The olfactory.
And usually in the Alzheimer people, it starts with one nostril more than the other, and it is specifically the left nostril. And so the test goes like you hold one nostril, and especially the right one, and you try to detect how, if you can smell it, and how far you can go to smell it.
Wow.
And they say they tried this test, it proved good, you know, and showed the results that those people have the symptoms of Alzheimer's.
Yeah, that's interesting.
So I don't know if it's true or not, but it was an article, Dr.
So it was a journal article, peer-reviewed, or?
No, it's not a peer review.
Oh, okay.
Just, we call it respected study
okay.
they have done. And they have done it more than 6,000 cases.
Oh.
Some of the 6,000 cases, around 3,000 cases, found this notes that the smell that they will be altered in the smell, and sometimes some distinctive type of smell, and mostly compared to the peanut butter, as they say.
Very interesting. Yeah.
I heard about it. It is one of the studies being done, but it's still not proven.
It's not proven still.
Yeah.
Jennifer Stan.
Yeah.
It's a doctor called Jennifer Stan.
Yeah,
in Florida University.
Yeah, still it is small scale study, we call it. But it's going to be approved longevity, we call it.
But I wonder, why is it the peanut butter especially?
It is not a peanut butter. The idea behind it is there will be altered in the smell, or distinctive smell. The most distinctive smell they found it is the peanut butter, but it's not a peanut butter. They asked the old person that, he said it's look like, it is look like, so it is not sure. But the idea behind it, there is a distinctive smell in that. It is one of the changes that happen with Alzheimer.
And also I read something related that during the Alzheimer, people usually let them eat a lot of coconut oil.
That was on the news today.
This is another. It is actually.
It helps.
No, it is a commercial.
It's a commercial.
It's actually a commercial thing that if you substitute this oil with coconut oil, it may will improve, but it's still study phase.
And the study was based that why in India is not.
But actually the problem is that in India we don't have what we call an official study about the Alzheimer disease. We have the same problem which we have here. We don't know how many patients we have in Alzheimer. So if you want to compare if it's true or not, you should do this trial on Alzheimer disease patients.
Yes.
You should not do it in general. That's the point.
Yeah. Yep. Yeah. You can. Can you listen?
I have a question. You mentioned, because I have a good news, I just let it flow, get it in the weeks, it has been published last week.
Okay, good.
I want to read it because this has been a concern for everybody who has a patient, a father, a grandmother who has Alzheimer. So did you mention anything yesterday?
No. No. I didn't talk about.
It has been proven that Alzheimer is not hereditary. Out of all the patients in the whole world have Alzheimer, there is at least in the state there is 4 million patients just in the United States. 150 families worldwide has Alzheimer runs in the family. That's it.
Yeah.
And those 150 all over the world. But the prevalence in those families are very high. 50% of them have Alzheimer, because just 150 out of million, which so very bad. if you have to
She said relax. Yeah, thank you. I don't think still people will relax. I don't. Yeah, they won't relax. And you know, even in my family, every one of my mom's uncles has it.
So you are one of the 150 people in this world.
Yeah, and so we're always looking around thinking, oh, who else is going to have it, okay? So yeah, they still will not relax.
I have a comment on this one. About the Alzheimer disease. It is genetic or not genetic? It's not a genetic. But the problem is where what are the other causes may sometimes overlap with Alzheimer disease can cause it as a genetic. You have a problem here. All the bloods, I mean, الدورة تتكلم هل هو مرض الزهايمر وراثي يتعارف عليه انه مو وراثي لكن يرجع بعض التساؤلات موجودة شنو طب ليش ينتشر بالطريقة دي وليش قاعد ينتشر بالطريقة انه لازم نرجع المشكلة مو في مرض الزهايمر مرض أمراض ثانية قد تكون محفزة لمرض الزهايمر المحفزات هذه قد تكون هي الوراثية وليس مرض الزهايمر. هذا الناس يقول أنا هو مرض الزهايمر.
يعني في أمراض محفزة؟
ايوه احنا قلنا الزهايمر في مسببات قد تكون احد المسببات ما زلنا في يعني دائما بين قوسين قد كلمه قد هذه المحفز هو الذي احنا قلنا هي تكلم في البدايه بعض المرات راح يكون عندك ان نسميها اجزاء بروتينيه تلصق في النهايه العصبيه نفسها. القطع البروتينيه هذه في جزء منها وراثي يجي وهي ليست خاصه في مرض الزهايمر يعني ممكن في اكثر من مرض لكن طريقه التاثير على الخليه العصبيه بالطريقه كذي جزء من البروتين يجي يكفل الخليه العصبيه يعني هي عباره مثل يكفل الخليه العصبيه. قطعه البروتين هذا بعض المرات في بعض العوائل تكون عباره عن وراثه زين لكن الاند ريزلت ماله هل راح يكون الزهايمر ولا باركنسون ولا راح يكون جيفن ديزيز ولا شنو بالضبط؟ هنا الاختلاف راح يكون.
She has a question about the medication.
About me? Yeah.
Can we prevent it before it's happening for people who don't have it? If it will cure the one who has it, we can prevent it.
So there isn't a cure for the disease. And so there's some medications that can kind of lessen some of the symptoms. But nothing is going to prevent it. That's just like today they were talking about the fruits and vegetables, vitamins that people are saying will prevent the disease.
هو من ناحية علاج الزهايمر نفسه في نتكلم مرحبا في شغلتين في العلاج. الناس معظم تتكلم عن العلاجات اللي تمنع مرض الزهايمر. لن يثبت للآن أن في شيء يمنع مرض الألزهايمر ولكن يؤخر مرض الألزهايمر. اللي احنا يتكلمون فيه مثل الآن مسألة الكوكونات أويل اللي هو نسميه زيت جوز الهند أو عندك مجموعات الفيتامينز أو مجموعات في بعض أنواع الفواكه. الفكرة شنو هي؟ لازم نفهم مفهوم الألزهايمر عبارة عن مرض عصبي له أكثر من سبب مسبب. يعني الألزهايمر عبارة عن عرض لعدة مسببات له. فالفكرة نفسها أن حتى الأدوية اللي قاعد تصرف لمرض الألزهايمر هي ما تعالج الألزهايمر، هي تعالج أعراض الألزهايمر تكون مصاحبة تسبب المرض هذا، ولكن هي ما تعالج الألزهايمر نفسها. فنرجع إلى الفكرة الأساسية، طول ما دام الخلية العصبية محافظة على نفسها لن تصاب بالمرض، زين؟ بمجرد ما تصاب الخلية العصبية هني بدأ المرض. الفكرة الأساسية وين؟ متى نقدر نمنع حدوث إصابة العصبية الإصابة للخلية العصبية؟ نمنعها متى؟ إذا منعنا كل المسببات الإصابة في الخلية العصبية، سواء عن طريق الأكل، سواء عن طريق الرياضة، سواء عن طريق الابتعاد عن الملوثات، سواء عن الابتعاد عن السموم، طريقة التغذية، طريقة التمارين، هذه كلها تدخل في تنشيط الخلية العصبية. طول ما أنا محافظ على الخلية العصبية اللي عندي معناته أنا ما راح يحوش الإصابة. مصيبة الخلية العصبية عندي خيارين، يا اما عن طريق البريفنتيف اللي نسميه اللي هو نطول في المرحله قد ما نقدر من المرحله الاولى والثانيه قد ما نقدر اللي هي المواد المحفزه للخلايا العصبيه، او ان نترك الوضع على ما هو عليه فالامر يتدارك بسرعه. فكل الادويه اللي قاعد ياخذها مريض الالزهايمر ليس علاج الالزهايمر، هي عباره عن علاج اعراض الالزهايمر فقط. لذلك لاحظوا ما بين فتره وفتره الدكتور يغير في العلاج، يجيب علاج جديد، يحط علاج جديد، هي لعلاج الاعراض المصاحبه لمرض الالزهايمر.
We have been talking about this for the last 2 days and lectures. Are these like statistics? Are they like it's from people who has Alzheimer, like from patients, like they have families that they know they detected Alzheimer, like because it's very hard to talk about it because it's a brain thing. You can never tell what's exactly goes inside the brain of a patient. Like, sorry, I just want to say something. Like this sound you just had when we were opening the bags.
Yeah.
Where did it come from? I mean, who gave you the chance to make such a recording?
Yeah. And so this, from doing the literature search on sound and perception, there's actually an article that says that if you, and I think the name is, I keep messing up the name, it's like cacophony. It's a type of background noise that produces a different type of stimulation in the brain. And so it allows you to not focus on the given task and to kind of think, what is this and what's going on? Because we know that the patients, the persons with Alzheimer's disease will get very distracted by noise in the background. And so this is just a simulation.
Well, the thing is that the reason I'm asking is because my late mom, she had for some time, she was diagnosed with dementia.
Yeah.
She would hear all the time such a sound. She would keep on telling us, I hear shh, like this all the time. And actually I took her to a doctor, ENT doctor, and he diagnosed her with some sort of an ear disorder, which is called tinnitus or something like this. And she kept on telling me, I don't believe him. I have something in my ear. And she kept on having the same problem for such a while. And she would just keep on, we didn't know how to help her. And then all of a sudden it subsided. Just all of a sudden. And it just sounds like her talking to me now. It just shocked me. I really, when the doctor said, no, it has nothing to do with her dementia, nothing. It's an ear disorder. It happens to the eardrum. He gave me such a medical term, and I did Google it, and it looked like it's something that's like credible. But it's just amazing. It sounds like exactly what she said. She said it sounds like TV at the end of the day when it's off, and it sounds like this all the time.
And so we know that when we move someone from a very loud area, especially in nursing home settings, if there tends to be a lot of people in the room and too many activities to go on, and you're trying to have someone work with you, or you're trying to have a conversation with someone or show them how to do something, that they're not going to be focused. But if you move them into a smaller room where the noise is controlled, they're going to be able to focus a little bit more.
And is it true that the Alzheimer patient do remember very old things in such a very strange way?
They do remember the old.
Between all of them, it's not only old age the way they say it.
No.
It's like scary what they can remember.
And so they will remember old things.
They do.
Yep.
Yes.
All Alzheimer patients, they retain their old memory.
And even more.
Yes. They retain their memory, the old memory, but they lose the recent memory.
The short term.
So I am telling you, one of the characteristics of Alzheimer, you will lose your recent memory, but you will not lose your old memory. So they always live in the past.
And so this is also why sometimes they will not remember their children's names. And someone mentioned that her mom did not call her by her name, that she always called her by her aunt's name. And so this is something that the person is recalling from her previous memory.
What about things when they see TV, a movie about killer or someone attacking someone else, and then they feel afraid and they believe that they live in that situation. So from your own experience, we suggest that they
I mean, they can watch TV. You know, I would probably refrain from watching anything that's too graphic, but even watching simple things might jog something in their memory. And so it's hard to say, because, you know, it's very variable with individuals, you know. You know, some people like to watch sports because maybe it makes them think about their childhood. But would I say don't put someone in front of the TV? I mean, ultimately you don't want to sit someone in front of the TV for a long time, but I would probably not let them watch scary movies. Yeah?
What about my question, please? About
yeah, say it, repeat the question.
How can we explain the Alzheimer disease to the kids? Sometimes they feel afraid that it's inherited, or why they're screaming, or we're struggling to feed them.
And so these are younger kids that we're talking about, like kids that are in their teenagers, or?
Around 6, 5.
Yeah, and so this is really difficult. And so you just, you know, because they're not going to understand, they're not able to put the pieces together, the kids. You know, that's like trying to talk about blood pressure and diabetes with a 5-year-old. How are you going to talk about cognitive impairment? You know, you can just say, you know, grandma's sick, you know, dad is sick, or whoever it is sick, and we just need to take care of them. Kind of like when you get sick and you have a cold, we have to take care of you. But they're not going to understand that young.
And you suggest to use the clock, the timing, to predict whether they have every stage of Alzheimer or not?
The clock?
The clock, set the time, you put the numbers of the clock 1, 2, 3 up to 12, and then you ask them,
the clock test?
Oh.
Yeah.
Actually, it should be the third or fourth stage.
Yeah. You know, it's not the only predictor, though. This is the thing, is that you can't just pick one thing to be a test, you know. It took me a while to...
that's why it's delayed until the family will take them to the doctor and say they feel something is wrong.
You know, there is some... You know, the mini mental test and all these tests is something that needs to be, the primary doctor needs to do that. I remember one time a nurse told one of the patients to draw a clock because she thought that something was going on. And this patient was so upset when she told him, you didn't draw it. He started to take the paper towels everywhere on his sheet, on his pillow, on his hand. He was doing the clock. And so it has to be done in a controlled setting with a healthcare professional. Yeah. Shukran, thank you so much. Thank you.
Something about Alzheimer. If you need to take care of Alzheimer, it is actually a group work, a team work. You cannot take it by your own.
I mean, when I will go to someone
Yes. This one should be, if you have a wheel, it's a little amount we put that into the
All done. We're done. He's just finishing up. Okay.